Good day everyone, this is Rose Garcia, a secondary nursing student from Section WIEDENBACH. So for today's video, I'm going to perform oral care for an unconscious or debilitated patient. It is a special care to the mouth, teeth, lips, and tongue to an unconscious or debilitated patient. For the assessment, we have to assess the condition of the patient's oral cavity, the teeth, the mouth, and the gums. Also, we have to assess for color, lesions, tenderness, inflammation, intactness of the teeth, and degree of moisture or dryness of the oral cavity. Third, we have to observe the external and the internal lips of the patient. Also, we have to assess the palate, the roof, and the floor of the mouth, and inspect under the tongue. Assess the entire mucosa, noting the inside of the nasopharyngeal area. Also, observe the tongue, noting the tip, side, back position, and underside. For the objectives, it is to remove plaques and bacteria, producing agents from the oral cavity. To allow the nurse to assess the patient's oral status, knowledge, and routine of oral care. To decrease the possibility of irritation and infection of the oral cavity and prevent sore formation. To refresh and provide comfort to the patient. To remove unpleasant taste and odors from the oral cavity, thereby preventing bad breath or halitosis. And lastly is to provide teaching when appropriate. For special considerations, the suction or bulb should be available at bedside for emergency use. If mouthwash is used, always rinse the mouth with water, following the steps in cleaning to avoid mouth irritation. A patient receiving chemotherapy may have bleeding gums and extremely sensitive mucous membrane. So we have to use the soft toothpaste for cleaning or substitute with a salt water rinse, which is 1/2 teaspoon of salt in 1 cup of water for brushing the teeth. For the equipment, we need to have the gloves, toothbrush, sponge or cotton applicator, water, mouthwash or hydrogen peroxide, towel, the water-soluble lubricant for the lips, suction catheter with suction apparatus, and your emesis basin.
First step is to gather the necessary supplies. Preparation promotes efficient time management and provides an organized approach to the task. Second is to explain the procedure to the patient to relieve anxiety and facilitates cooperation. Next is to perform hand hygiene and put on gloves to deter the spread of microorganisms and prevent contact with microorganisms in blood or saliva. Close the curtain to protect the client's privacy. Raise the head to a comfortable height. Lower the near side ring. Turn the client on the side toward you and with the client's head tilted down toward the mattress. Proper positioning prevents back strain, and tilting the head downward encourages fluid to drain out of the client's mouth. Place a towel or emesis basin under the client's chin and have a suction catheter and apparatus available if needed. The towel protects the client and the bed, and the emesis basin and suction equipment facilitate drainage from the client's mouth. Next is to open the client's mouth and insert the padded tongue blade toward the back molar area. So this assists in keeping the client's mouth open. And never insert your fingers into the client's mouth because as a reflex mechanism, the client may bite down if fingers are placed on his or her mouth. Dip a toothpaste sponge, soft toothbrush, cotton applicator, or another padded tongue blade in water, mouthwash, or diluted hydrogen peroxide. Move it back and front gently across the client's teeth and chewing areas. Cleanse the roof of the mouth and the inner cheek area. Friction cleanses the teeth, and the gluing solutions aid in removing residue on the client's teeth and in softening encrusted areas. Rinse the areas using a clean toothpaste, cotton applicator, or padded tongue blade moistened in water. Suction any drainage if necessary. Rinsing or suctioning removes cleaning solutions and debris. After drying the client's mouth, apply water-soluble lubricant to the client's lips. This prevents lips from drying or cracking. Reposition the client, lower the bed, and raise the side rail again. Repositioning with the bed at the proper height and side rails raised provides for the client's comfort and safety. Remove gloves and wash your hands to prevent the spread of microorganisms. Lastly is to document assessments on the health record, since documentation provides communication and coordination of care.
For the evaluation, the teeth of the patient are free for play. The mucosa is moist, intact, and have a uniform color. The tongue is well hydrated as well as the lips are smooth and hydrated. The bacteria-producing agents are removed from the oral cavity, thereby preventing halitosis. The client experiences no oral discomfort.